Hello.
Hello.
It's really good to see you.
How are you?
I'm okay. What's going on this summer? Nothing? I became a doctor because I actually wanted to be a pediatrician. I loved taking care of children. But it was in medical school I realized I really enjoyed the technical aspects of surgery. I trained as a classical singer, and so a lot of my young years were spent around performance. And the operating room feels very much like that to me. Once you're there, it's really should feel more like muscle memory and executing a plan rather than making up things on the go. I came for a rotation at Boston Children's Hospital when I was an intern and was just blown away. And I kind of haven't left since. I'm Dr. Prathima Nandivada, and I'm a pediatric surgeon at Boston Children's Hospital. Which yeah.
So
strong. You're so strong. Look at that. I'm a colorectal surgical specialist, and that means I take care of problems mostly of the GI tract within the abdomen. I like to say I take care of two groups of patients. They're the little babies with congenital problems or things that they're born with. And then I have a really cool group of teenagers, and these are kids who are suddenly finding themselves sick with things like Crohn's disease and ulcerative colitis. There are very few problems I take care of where there aren't lots of other medical specialties involved. And it's actually one of the things I really enjoy about my work is getting to be on a team with all these other really smart and thoughtful people. One of my main focuses in the Colorectal Center is in Hirschsprung disease. One of the things we've been working on recently that I've been spearheading is really connecting what we can learn about Hirschsprung disease in the lab to what we do in the office or in the operating room. I literally talk about some of my research with some of my patients, and I'm often updating them on what's at the frontier that might be available for their child 5-10 years from now. I think we're going to see more and more minimization of these robotic tools that are going to let us do really elegant operations in tiny little people and allow us to be minimally invasive in a way we just haven't been able to be in the past. Some of this recovery will be slow. So the early part, I think you're safe and ready, and then as long as you're eating, drinking, walking, and your pain is okay on just Tylenol and Motrin, you can go home. I love reconnecting after an operation and seeing how things are going. That's my favorite part of the day. Trust is such an incredible part of the surgical experience, and it's such an incredible privilege to have a family give you that trust. And taking care of patients and families who are dealing with both sides of this, something from the very beginning and something that pops up later in life, requires some different unique approaches, but all of those patients have taught me really amazing things about life, and I feel really lucky to be able to take care of them.